Karen Peabody from Forgewell Solutions, and I am here with Cyllene. And we are going to talk about a few ideas that she has to help support people, especially through this time, but through any time, really. And I think this is a great way because Cyllene is fairly new to the office to introduce her to everybody. So welcome, Cyllene. Thank you so much for being here.
Thank you for having me.
So we were going to talk a little bit about having networks of support.
Yes, absolutely. So
talk a little bit more about that?
Sure. So I've been in clinical practice now a little over 15 years. I had started out as a master's level therapist, and then I became a nurse and a nurse practitioner. And I used to work in the emergency department, and I would do crisis evaluations. And one of the things I had noticed is that when patients don't have at least 5 supports or networks that they can identify, they're more at risk. They're more at risk of depression, anxiety, and the effects of those symptoms. So having at least 5 supports that you can name, it could be family, friends, it could be associates, it could be community supports. So having at least 5 really protects you from depression and anxiety and other mental health disorders.
Right. And that falls really right in line with all the research talking about how important human interaction really is. So I think that's such a good reminder for everybody in their everyday life, especially in a social distancing situation of people are really important.
Absolutely. They are.
So where do you think some of the best networks of supports where can they be found?
Well, some of the common ones are family, having siblings or parents. Those are the most common. And then some friends, people that you've known throughout your life. And if you haven't been in touch with them, this is a perfect time to reach out to people. Sometimes people are nervous. They don't want people to know they're going through things. They feel like, I don't want to tell my friends and family what's going on. But knowing that, letting those know what's going on is actually protecting you and helping support you with your illness and whatever you're going through, that can help to quell that fear of people knowing, because having those supports may help prevent that symptom from exacerbating. They can give you moral support, physical support, emotional support. So it's the way we kind of view our network. We view our network as necessary, then we're going to utilize it.
Right. And I think too, when we talk about having networks of support, it doesn't mean that you have to go lay it on the line to anybody. Sometimes just getting little pieces of support in different ways is really helpful too.
Absolutely. And you giving support, sometimes you can call somebody and you're looking for them to tell you something positive. You might be the one to give them the positive support or give them the encouragement. And there's always more benefits of helping people, and you feel better, and it helps you to gain more perspective. Like, oh, I thought my situation was bad, and here this person's going through something, doubly worse. And so it helps to not just think of ourselves, but to think of others, and not just using that network for our benefit, but it helps them too.
Right. And so if people were hesitant, about, they're listening to this and they're like, oh, I wonder if I have 5 people, and I don't know how to go about doing that. How do you recommend people building that?
So if you're not sure, if you can come up with maybe 2. One way is to look at your environment. Our neighbors, sometimes people in our buildings, or people that live nearby. It could even be the postman, someone you see on a regular basis. Just starting to have an interaction with them, making a point to speak to people, to inquire, how's your day? How are you doing? I always see you. You must be hot. Let me give you a water. Or, just showing interest in others might just be the first step in that networking.
But what I was saying is it could be kind of these little interactions too that can start to build. It's almost like this energy exchange that needs to happen with another person or another animal, I guess,
Yeah.
that starts people feeling a little more seen.
Yes, absolutely. It takes you out of yourself, and it helps you to look at the world not just in your eyes, but how are other people doing? Not just me, but how is the world doing? How's my neighbor doing? Those things do impact us at the end of the day,
Right.
in some way or another. They do affect you.
And I also think, if you're able to connect with somebody and they are kind of mirroring some of the things that you're going on for you, of you have anxiety, you feel lonely, you feel, isolated, and you see somebody else that might be saying the same thing, sometimes that's helpful too, to be like, wow, I'm not the only one. Like, this is normal.
Yep, and you're not alone. There are many people. I mean, I tell my patients that depression is like a cold. Everybody's experienced a cold. And the flu is a little different. That's more of a clinical state. But everybody's experienced some form of even anxiety. There's good and bad. So you're not alone.
Yeah. Yeah. And which is so important. Like that, almost like that is the cornerstone of humanity, right?
Mhm.
It's kind of, we're all mammals. We need to be together. There has to be some sort of connectedness.
Absolutely. Well said.
Um, what I think is important that maybe we skipped right over, I'd like to highlight that Cyllene is a therapist and a prescriber, which
Yeah,
is really an amazing combination. Amazing, I can say, for the office, certainly to have, but I think it's important for people to know that you're both of these things.
absolutely. I definitely incorporate therapy in every interaction with patients, even if it's solution focused or if it's just like a narrative approach. But I always focus some aspect because I don't believe that medications alone are the answer. If there was, we wouldn't necessarily, everybody would take a medication.
We wouldn't have jobs.
No, no. So it's a combination. It's a dual approach or even multiple, combinations that are helpful to help people get to a remittance of their symptoms.
Right. Because I do think it's important for people to know, because I know people have come to me thinking, oh, good, I finally get an appointment with you, now I'm thinking about this medication. And then to hear like, well, I don't give out medication. Now you have to get an appointment with somebody else. So if you already know from the get-go that medication is something that you're looking for, like, you're probably the perfect mix for that.
Absolutely. And, even with the medication, sometimes people need to get to a point where they can participate in therapy. Sometimes their symptoms are so severe that they can't participate. Their fears or their sadness prevents them from being able to speak and discuss things. And by starting a treatment, they're able to now engage appropriately and they're able to work on things that have been difficult to do prior.
Right, right. Wonderful. Thank you so much for being here. So if people want to find you, Cyllene, how would they go about doing that?
Well, one of the networks is Forgewell Solutions, and you can go on the website. There's wonderful clinicians, including myself, that are here to help. And you can also go on my own website, which is contentahealth.com, and you can send me a message at intake@contentahealth.com. You can call me at 617-202-3003. So again, that's Forgewell is one of the places you can go, forgewellsolutions.com. You can go on contentahealth.com. You can send me an email at intake@contentahealth.com, or you can call me at 617-202-3003.
Great. And I guess one of the most important questions are you taking new referrals right now?
Absolutely. I will definitely take a phone screen and I will let people know if I can help them. I definitely am looking for more patients and I'm here to help.
Wonderful. Thank you so much. It was great to speak with
Oh,
you.
you too, Karen. Take care.
Bye-bye.
Bye.